Good morning. Thank you to the organizers for the opportunity to speak today. Today we're going to discuss the emerging global epidemic of childhood obesity in the Caribbean and its burden. Pediatric obesity may shorten life expectancy by 2 to 5 years by mid-century. This is an effect equal to that of all cancers combined. And since these alarming words from the New England Journal of Medicine, the prevalence of childhood obesity has increased throughout the world. Currently, over 38 million children aged 5 and under are overweight or obese. So what exactly is obesity? The World Health Organization defines it as the abnormal or excessive fat accumulation that may impair health. And childhood obesity is attributed to serious medical complications in childhood. In the Caribbean, 1 in 3 children is overweight or obese. And compared to the rest of the world, the prevalence of obesity in the Caribbean is 2 to 3 times higher. And within the past 2 decades, what we've seen is the prevalence of obesity in the Caribbean has risen. And this is mirrored in our home here in Antigua and Barbuda. Caribbean countries vary in size and wealth, but despite that, they suffer from the same leading causes of death. And even though Antigua and Barbuda is a high-income country, it suffers from the same non-communicable diseases as our middle-income neighbors, specifically cardiovascular diseases, diabetes, and cancers. And one of the main drivers of non-communicable diseases are in unhealthy diets. In the Caribbean, food consumption patterns have changed. And right now, we're having less healthy diets, more processed foods, more sugar-sweetened beverages, more animal products, more added sugars, more fats and oils and salts, and alcohol. And the Caribbean has a long-standing relationship with alcohol. 3 factors drive the evolving food culture in the Caribbean, specifically the availability of food. There's a reliance on imported foods, and due to an inadequate supply of local produce, there's issues with accessibility to food with ever-rising food prices and a widening socioeconomic inequality. And the stability of our food supply chain can also be affected by economic factors and extreme weather events. And multiple factors promote obesity in the Caribbean, specifically our individual genetics or behavior, food choices, physical activity choices, but the environment plays a significant role. Parental guidance and family culture. We know that breastfeeding protects against obesity, and not enough of the population is breastfeeding. The less educated make poor choices, and poverty can also affect choices as well. And the foods that are available are unhealthy and they're affordable, and these foods are aggressively marketed. So all these contribute to promote obesity. And this is just a glimpse of the obesogenic environment in the Caribbean. Here we see the frequency of soft drink consumption and fast food consumption, and at least children in the Caribbean consume at least 1 soft drink a day and eat fast food at least once a week. And overall, childhood obesity can have a significant impact on children. It can affect them emotionally and psychologically. Children can suffer from low confidence, low self-esteem, can be discriminated against, excluded from physical play, and experience bullying. And physiologically, obesity can be detrimental to health, and continued obesity into adulthood can lead to non-communicable diseases such as high blood pressure, diabetes, and cancer, cardiovascular diseases. And because the Caribbean economy is extremely dependent, externally dependent, that plays an important role in promoting obesity. We rely on international trade for goods and services. There's high dependence on tourism. And there are inequalities in each Caribbean country, but if we look at Antigua and Barbuda, it's a high-income country with pockets of poverty. And on top of that, there's consumerism, so there's first world choice, for high-income individuals want to have foods that are imported as opposed to locally produced. And on the other spectrum, we have people seeking subsistence, so they want cheap and convenient foods. So childhood obesity affects all socioeconomic brackets. And the obesogenic environment will have a tremendous financial burden economically because obese children lead to obese adults, and that can have a multifactorial effect on individual health, socioeconomic opportunities, the labor markets, GDP, and overall economic growth. And from a health economic perspective, child obesity has and will have a tremendous financial burden. So just looking at the indirect and direct costs of obesity, in the US in 2018, we spent $1.72 trillion. In 2015, the Caribbean spent $68.5 billion. And the projected cost by 2025 in Antigua and Barbuda is going to be $125.4 million.
Good morning, everyone. I am Tirath Patel, and let us look at the global impacts. We know that global impacts can further exacerbate the childhood obesity epidemic, and there will be future pandemics. Now, if we look at the regional impact of COVID-19, then we know that healthcare services, economy, and food security were severely impacted. And there was a sharp decline in GDP of all Caribbean nations, with the highest drop in GDP of St. Lucia having 20% GDP drop. There has been an anecdotal increase in childhood obesity during lockdown. Every catastrophic climate-related event pushes back the economy and makes us more food insecure. Same trends are happening with our neighbors, with there is average decrease in annual rainfall and increase in temperature, increase in frequency and intensity of hurricanes. Climate change has its own impact on children by increasing risk of chronic diseases and affecting mental and physical health. Earth's climate is now changing faster than at any point in the known history of climate, primarily as a result of the human activities. There is scientific consensus that unmitigated carbon emissions will lead to global warming of at least several degrees, resulting in high impact of local, regional, and global risk to society and natural ecosystem. Global climate change has already resulted in wide range of impact across every region of Earth, as well as many economic sections. At the end, I would like to quote from Dr. Asha, "The opportunity is now for us to be proactive and systematic to support child and adolescent health to secure a resilient, productive, and positive Caribbean future." Thank you.
Hello everyone. Good morning. My name is Trinad and I'm a Med 2 student at AUA, and I'll be providing an overview of the financial aspects of tackling childhood obesity. In 2014, the World Health Organization estimated that globally, obesity in adults was costing over $2 trillion US across the world, which is an unfathomable amount. So preventing obesity in childhood was a prominent strategy in reducing the financial burden of the global obesity epidemic. In response to the alarming rates of childhood obesity globally, the World Health Organization Commission on Ending Childhood Obesity and Decade of Action on Nutrition detailed a global call to action. This call to action was released in conjunction with the initiative, No Increase in Overweight Among Children Under the Age of 5, school-age children, or adolescents by 2025. The call to action includes recommendations for 1, policies supporting healthy food environments for mothers, infants, and children, 2, ensuring safe and accessible areas for physical activity for children of all ages, and 3, universal health coverage for everyone to have access to treatment services and obesity prevention. These global calls to action are echoed and further expanded upon in the strategic plan created by the Healthy Caribbean Coalition, or HCC for short, targeting several outcomes that are achievable and realistic. In order to be successful, obesity is a problem that must be targeted from economic, educational, and interventional standpoint. Furthermore, these actions require monitoring, constant reassessment, and checks and balances in order to be most effective. Currently, within the Caribbean, the steps have been taken by the Healthy Caribbean Coalition, the CARICOM, and the Childhood Obesity Prevention Civil Society Organization to combat childhood obesity, such as conducting surveys to help determine appropriate labeling for food packages and encouraging backyard gardening. On a policy level, we can take a look at Jamaica, who has taken the necessary steps to reduce sugary beverages in schools from 6 grams per 100 milliliters to 2.5 grams per 100 milliliters by 2023. Or Barbados, who has increased the taxes on sweetened beverages in 2015 by 10%. They're even considering a further increase of 20% to further mitigate the effects of sweetened beverages. And Bermuda, who has developed policies for healthy foods and beverages to be sold on all school premises. And this is all in line with the HCC strategies in reducing consumption of sugary foods, and it puts us one step closer to reducing the global levels and the Caribbean levels of childhood obesity. On a community level, we have also seen the growth of interventions led by Food for Change Caribbean and the CARICOM to directly improve contextual factors that can lead to obesity. For example, the Women's Farmers Academy, which helps remove barriers for women to receive agricultural training, and the 15 Small Grants projects to help farmers generate sustainable sources of additional income. When our farmers locally are supported, that means that there will be less need for people to select unhealthy food choices and more of an urge to select cheaper, healthier food alternatives. Other notable steps that have been taken are the engagement of faith-based spaces for creating healthy food habits and trans fat reduction elimination policies. However, there are also gaps and inadequacies that must be addressed immediately. Risks associated with the HCC action plan implementation, such as being unable to receive the relevant funding and strengthening technical partnerships with third parties, lacks of awareness of the childhood obesity prevention, and the need for intervention by different levels of authority, as well as limitations in policy development, are all factors that must be considered when moving forward. When we analyze the gaps in the CARICOM policies, it's important to recognize the lack of accountability and compliance, and there are no clear sanctions and penalties for tertiary level educational organizations, such as private institutions. More recently, there has also been impacts due to climate change. Hotter and drier weather has caused the destruction of forests, wildlife, and property. Overall, this has undermined efforts in improving agriculture and has increased the food insecurity in the Caribbean. A lack of healthier alternatives drives increases in the consumption of unhealthy food choices. And finally, COVID-19. while it's no big secret, it has also affected us. COVID-19 has worsened efforts towards combating childhood obesity. Whether it be an increase in sedentary lifestyle as a result of increased online education, increased urgency towards implementing COVID-19 policies and a neglect of childhood obesity policies, or the financial burden on the Caribbean due to decreased trade and tourism. Thank you so much for your time today. I will be handing it off to Group C.
Hello everybody, my name is Sunhit. I'm also an AUA Med 2 student, and for our last part of our presentation, we're going to be discussing about proposed initiatives for helping to combat childhood obesity in the Caribbean as well as here in Antigua. Okay, so for the end of our presentation, we're going to be discussing three different areas. We're going to be discussing both regional initiatives, then governmental, followed by community-based initiatives. So first, for our regional initiatives, we'd like to talk about the Healthy Caribbean Coalition Guideline. So this action plan cites several major NCD risk factors that are concerning your unhealthy diets and physical inactivity. We believe that all CARICOM countries must take into account all of these initiatives and implement them as quickly as possible. So these are included in the list above, but also include legislation concerning breastfeeding and breast milk, ban on marketing of unhealthy foods and beverages in children, ban of sales of unhealthy foods in school, mandatory physical activity, as well as policy monitoring. So we'd like to first talk about the adaptation of front-of-package warning labels. So these labels, as we've shown here, are simple. They are based upon simple labels that can be placed on any food items. We believe that placing these items on any food items that are high in calories or high in sugar, saturated fats, trans fats, and sodium will help to reduce individuals as well as consumers in purchasing these products. For example, the products will bear the labels of excess sugar, high in sugar, or high in saturated fats for any food item that presents 10% or more of these items in their total calories. So this approach has been supported as a rights-compliant response in a recent statement by the UN Rapporteur. So they state, as part of this approach, the PAHO nutrient profile model allows the identification of products that should contain warnings on that front of the containers for their excessive content of critical nutrients that can affect health as well as childhood obesity. So many countries are actively considering applying these front-of-package labels. Many first worlds have also already applied placing labels upon food items. However, during our research, we discovered that no CARICOM country as of 2018 has placed any sort of labels on their foods for warnings for children, especially those that are high in fat, sodium, as well as sugar. So there is precedence for success of this policy. For example, in Chile, where the purchase of sugary beverages fell by almost 24% after there was introduction of food labels on, especially for children. So it is important for CARICOM countries especially to adopt this policy, as there is not only precedence but much optimism for the success in reducing childhood obesity. Okay, next, we'd like to talk about some governmental initiatives that can be undertaken by various Caribbean nations. Going from clockwise upon our scale, we'd like to start talk about the clean and accessible water in all schools, followed by mandatory physical education daily, better data collection and allocation, as well as budget reallocation in order for preventative medicine as opposed to reactionary, and finally, interministerial collaboration. So first, for clean water. So the United Nations believes that clean water is an absolute right for all human beings. By 2030, we believe the United Nations has mandated that achieve universal equitable access to safe and affordable drinking water, and also achieve access to adequate and equitable sanitation and hygiene. It's very important, especially for children and childhoods, for maintaining to have clean and access to clean water. So we believe that mandating filtered water fountain and stations on school campuses will extend this, will help to provide better nutrition for children as well as make better options. Next, we'd also like to mandate physical education in schools. So currently, here in Antigua, children are only mandated for physical education for 45 minutes per week. We believe 45 minutes per day is a much better policy as opposed to 45 minutes per week. So our research suggests, as shown above, that increasing fitness and physical activity greatly improves cognitive function and brain health, with higher fit children demonstrating attributes such as greater attention, faster information processing, and higher scores in standardized achievements. So this policy can cost very little additional money, and the only thing required is planning and policy implementation. The only other issue we could look here is that we would also require additional screenings in schools in order to ensure that this policy is being mandated. For example, twice yearly, we would allow all children to follow a take a BMI index scale so that we can ensure that these policies are being followed through. Additionally, we would also ensure that in order to allow physical activity, we would also need to ensure that children are given nutritional literacy training in order to ensure that they're eating the appropriate foods and getting the nutrition in order to compensate for their increased physical activity. This early intervention is extremely critical. As you can see here, obesity can start as early as the age of 6, with 14.7% of the children in Antigua and Barbuda's children being obese. So we believe early intervention is extremely crucial to ensure that we can prevent childhood obesity before it becomes an issue. Lastly, we want to talk about intercommunication between governmental ministries. So what we mean by this is that we recommend a formation of an interministerial committee between existing governmental departments. An example of how this interministerial committee could work would be through the extended L3F program. By creating policies to support and supply the initiative on a government level, both financially through reimbursement to the farmers and extending marketing in schools. This would help to increase the connections already established with the Ministry of Agriculture, hotels, and supermarkets that currently support the participating farmers. There is precedence for success of this policy. For example, in Jamaica, has already established such an interministerial committee for poverty in 2003, human rights in 2015, as well as now currently where they're also looking to make one for financial health. Lastly, I know we already had several presentations on data, so I will not bore you on that. However, so currently we would also, we need data, so what we believe is that data should be better collected as well as allocated in order to amplify the resources we currently have. This data should be analyzed and provided to appropriate ministries as well as policies so that they could create the appropriate laws and policies to help assist in combating childhood obesity. Lastly, we would also like a budget commitment. This would allow, essentially stating that governments should uphold the funding that they are promising to various schools as well as the healthcare industry. Without a proper budget commitment, you can't carry through with any of the policies. So this is something that we are looking to enforce. Finally, in terms of the community, we would, this is one area that we were looking to amplify the school and home garden programs to reach more families while providing education on climate change and agriculture improvements. So basically, keep your community safe. And lastly, on a regional level, we would like to talk about just fostering better relationship between private and public partnerships. This is essentially saying that the goal of this is to financially incentivize the private industry with the prospects of helping with marketing and guidance to create a product desired all over the world and the region, and bring prosperity to those involved in production, harvesting, and packaging. So the creation of sustainable private-public partnerships with the common goal of improving childhood health. This is something we believe is most important, as the private industry and healthcare industry as well as the community must work together in order to combat childhood obesity and improve nutrition value. Thank you very much.